Well, I think we should get started. My name is Kristine Sorensen. I am the president of the International Health Literacy Association, and I'm based in Denmark, so it's 9 o'clock here in Central Europe at this point, and I know many of you are joining from across the world. We have seen already participants from Lebanon, Israel, India, and Taiwan. And we're very pleased and honored that you are joining this series of webinar to discuss the outbreak of the novel coronavirus. So I'm speaking on behalf of the International Health Literacy Association, and we are very pleased to welcome you to the second webinar of our list here. The first one was on how to find solutions for infodemics, and this one, our second one, is on the COVID-19 and how the response has been through Taiwan. Let me just introduce the International Health Literacy Association very shortly. Our aim and scope is to promote health literacy for all. And we are a non-governmental organization open to everyone. We have individual memberships and we have affiliate memberships, which can be organizations or institutions or companies. And we run by and for our members. It means that most of our members are also engaged in our interest groups. That could be, for example, to discuss how we can improve health literacy for children, health literacy in schools, health literacy research, how to improve the sustainable development goals through health literacy. There are many different groups also on inequalities. And you're very welcome to explore our website, which is www.i-hla.org, where you can find much more information. And at this moment, our membership is free, and we do hope that you would like to support us also in the long run. But let's get back to why we are here. And that is because we're zooming in on Taiwan. We are having our Global Health Literacy Summit next year, 3rd to 5th October in 2021 in Kaohsiung in Taiwan. But we were supposed to have it this year, but due to the novel coronavirus, it was not possible. So instead, we are now launching these webinars. And we are very happy that our colleagues in Taiwan has offered us to share some of their ideas and solutions on how to cope with this situation. And at this point in time, I would like to hand over to my co-chair, who is Peter Chang, and who's also our vice president of the International Health Literacy Association and the Ombudsman in Taiwan. Peter, you will be the chair leading us through the 3 presentations we have today.
Thank you, Kristine. Thank you that it's been a great pleasure to be coordinating this second IHLA webinars. And now the topic is Taiwan's response to the COVID-19. It's a collaborative crisis communication and resident. We are having 3 speakers for today's very intense webinars. And I would introduce each speaker right before their presentation. Each speaker would have a maximum of 15 minutes, 15 minutes. And I see this is a webinar not only on Taiwan. The issue to myself is that this virus is incredible, totally unbelievable, mysterious. Still, we don't know exactly everything about this virus. That the virus still ongoing, and the second wave, and in many other countries still there. We learned that in Singapore, Hong Kong, and in China there are new waves ongoing. And this is a time we learn from each other. But how Taiwan can respond to this COVID-19 smartly when we talk about health literacy, not only the office, but the people, the public, which has to learn how to wear the mask to keep social distancing. Really, it's a smart health practice. So I see that it's very important how we can educate. We provide the best service for the public, which is vulnerable to this new virus, very intelligent, very efficiently. So I would introduce the first speaker, Professor Hsien-Ho. He is now a professor in National Taiwan University School of Public Health. I met him several years ago in Harvard School of Public Health when he got his PhD there. Now he is full-time on infectious disease epidemiology study research in Taiwan, in Asia. So I think we are very happy to have Dr. Lin to talk about his topic was epidemiology and country experiences. Dr. Lin, please, you have 15 minutes.
Thank you. Thank you very much, Professor Chang, for your introduction. Let me try to share my screen. Can you see my screen now? Can you see my screen?
Very good, Dr. Lin.
Okay, so I'm going to start it. So I'm going to talk about the epidemiology and country response of COVID-19 in Taiwan. Especially, I will focus on the country response earlier during the epidemic, because after April, essentially Taiwan has almost closed the border by undiscriminative quarantine for incoming passengers. So I focus more on the earlier response in the country. Okay, so this is the epidemiology of COVID-19 in Taiwan. And essentially in January and February, we have a mixture of imported and locally transmitted cases. And then this was followed by a lot of imported cases in March and also in April. But relatively very few local transmission. So if you look at the reproduction number, how many cases generated by one case, it was initially sometimes as high as 2 to 3 in the beginning, in February and January, but had been pretty low since March, way below 1, so which is good, because essentially for epidemic control, we want the reproduction number to be less than 1 and as low as possible. And in terms of the major responses of COVID-19 in Taiwan, importantly, we have the Central Command Center and Resource Securing in the very beginning. And then broadly, the interventions in Taiwan can be classified into reducing the impact of imported cases. That includes border control, home quarantine of returning residents, travel history alerts, and reducing local transmission. That includes case-based intervention and population-based intervention, which I will talk about later. And I think importantly, the overall goal is to protect the healthcare system so that we don't have overloaded ICU and hospital beds. So we have the first case of COVID-19 in January 21st. But the country response actually started much earlier before that. So on December 31st, one of our medical officers of Taiwan CDC noticed the news about the unknown pneumonia in China, especially in Wuhan. So on the same day, Taiwan CDC started this onboard quarantine of all direct flights arriving from Wuhan. So essentially starting from December 31st, our CDC has been in very close follow-up of this unknown epidemic. And then by January 20th, the government has set up the Central Epidemic Command Center. And on the next day, we actually notified the first COVID-19 case. So this is the Central Epidemic Command Center led by the Minister of Health and Welfare, Dr. Chen. But it's a multidisciplinary, multi-sectoral center that involves people from different departments of the executive branch. And right before we start to fight the outbreak, the important thing is about the resource allocation and resource securing. So by, remember, have the first case on January 21st, and right after the first case, there has been a huge and increasing demand of face masks. And our government knew that because during the 2003 SARS outbreak, there was a similar increasing demand of face masks. So in order to ensure that there is enough face masks to use, on January 24th, the government had a export control of N95 and surgical masks. And then by January 28th, they started a centralized management of all the medical masks. So only the masks were only released at the convenience stores so that we have enough to supply to healthcare professionals. But that didn't seem to be enough. So by February the 6th, the government started this name-based rationing system for mask purchase. So the purpose is to ensure that everyone have access to face mask, but no one can secure a large stockpile at their homes. So the way the government has done that is through this the National Health Insurance affiliated pharmacies. So all the masks were delivered through the pharmacies. And also at the same time, we had rapidly increased the production of face masks from the baseline of 1.5 million to over 10 million by mid-March. So in the beginning of the outbreak, whenever you go to all the pharmacy stores, you'll see that people lining up to try to get the face mask. So essentially, there's a large chance you can get it, but people have to line up for quite a long time. So the information team in the government, they have this idea of open data for mask storage. So essentially all the information for the face mask storage and the delivery were released as a kind of open data. And so at the time, there were about maybe dozens of different apps that make use of the information of mask storage so that people can have some idea about where they should go in terms of getting a mask efficiently. So the stores in red means that they're out of stockpile, and the stores in green means that there's still a large stockpile of the face mask. So you can click on the map and know the storage of the face mask in all the pharmacies. And how do we do this delivery? We did this through this National Health Insurance IC card. So this IC card, usually we use this for healthcare seeking. So this is mine. But during this period, it has been used to get and obtain a face mask. So it's a name-based system. And the next thing is to reduce the impact of imported cases through various ways. And so one example I'm giving is the travel history alert in the medical information system. So again, it is based on the National Health Insurance card because we have this National Health Insurance ID so that we can the government can link the information of immigration to the National Health Insurance card. So whenever a person having any symptoms going to a healthcare system, and whenever they plug in this National Health Insurance card, if he or she is coming back from a different country that is under alert, then this kind of message will pop out to notify the doctors or nurses about the travel history. So we don't have to rely on the self-report of the travel history. And another example is the management of the Diamond Princess cruise disembark. So now you all know the Diamond Princess cruise ship. And the outbreak was notified somewhere in early February. But actually, before the outbreak was known, the cruise ship actually disembarked in Taiwan, in northern Taiwan, on January 31st. And nearly 3,000 passengers actually entered Taiwan. So by the time the government, we knew the outbreak was already too late. So the way they tried to reconstruct the passengers' routes is that they used the mobile phone signals. So once they landed in northern Taiwan, they tried to reconstruct these travel routes of these passengers through the mobile phone signals, and then link this to the mobile phone signals of the local residents. So all the citizens in northern Taiwan who had a common location and time in terms of the interaction with the passengers, they received a SMS message so that they knew that if they develop any suspicious symptoms after the incubation period, they should be aware and should go to the healthcare systems for care. And also the government highlighted the sort of the hotspots so that those people who went to these hotspots on the same day, they should be aware of their symptoms. This is this SMS message. So lastly, the major responses in terms of reducing local transmission, there are, I would say, twofold. One is the case-based intervention. So the case-based means that the target is mainly on those who have COVID-19. So this is mainly the contact tracing to identify all the close contacts of the cases and the home quarantine of all the close contacts, regardless of symptoms. And another approach is a population-based measures that is targeting at the general public, not just those who are sick with the disease. And this includes general social distancing and reducing mass gathering and face mask use, etc. So we actually use this combined approach to reduce local transmission. I'll just give one example of how we use this very detailed contact tracing data to better understand the transmission of COVID-19. And so the key question at that time about the transmission of COVID-19 is whether people can transmit the disease even before they have symptoms. So we analyze the contact tracing data in Taiwan and try to answer this question about the transmissibility before and after the symptom onset. So this was done by a research collaboration by the National Taiwan University, our team, and Taiwan CDC, led by Professor Yuan. So essentially what we found by analyzing the contact tracing data is that if you look at the time trend of transmissibility, we found that the COVID-19 is actually quite transmissible very early on in the disease course. So as early as day 0, actually even before day 0 of the symptom onset, people can and already have the transmissibility, the cases. And by day 6 or day 7 after the symptom onset, actually the transmissibility has largely decreased. So this is actually in a huge contrast with SARS, where people actually is very not transmissible in the very beginning, but very transmissible at the late stage. So that is actually a bad thing for the control, which means that we probably cannot just rely on the case-based intervention only, but we also need the population-based approaches. So in retrospect, did all these interventions work? It's actually very difficult to answer this question because we've done many things at the same time. But if we look at the evidence from other sources, this is the trend of the severe confirmed influenza. So we actually see that in the early 2020, the influenza cases were pretty high, but followed by a very rapid decline of severe cases. So which means that probably what we have done in terms of all these measures seem to have some collateral benefits, not just to the COVID, but also to other respiratory infections. So just to conclude, we seem to be doing okay or doing good in this kind of first wave. But I would take the analogy of baseball game. So we're probably in the first, maybe the second inning of the baseball. of the ball game, but definitely not the ninth inning. So the questions that been discussing a lot is the sort of the second wave. So how do we prevent the second wave of infection? Whether we have to continue this very strict border control at the cost of economic damage, potential damage, or if we can come up with any alternative way to kind of balance the kind of openness and the epidemic control. And so I will stop here and I welcome any questions that follows. Thank you.
Thank you, Dr. Hsien-Ho Lin, for your very concise presentation. And I hope we have some minutes to the end to learn of how do you counterbalance, countermeasure the second wave, which is apparent it's coming by the end of the year. So without any ado, that I would like to invite the second speaker, Professor Jen-Kuei Peng from National Taiwan University Hospital, but also he is a PhD from King's College London, just coming back from London. I didn't know how did you manage to come back, but anyway, your presentation will be New Southbound viewpoint. Apparently, that's your neighbor. How do you deal with the neighbor relationship in terms of this quarantine population migration? Professor Peng, you are welcome.
Hello, can you hear me?
Yes, very well.
Yeah, thank you, Peter. Yeah, I have to apologize that I just come back from my clinic. So in the slide, there are some Chinese or Taiwanese characters, but I'll surely, speak in English. Okay?
Sure. Yes.
Okay, thank you. Yeah, so I'll have a very brief introduction to the New Southbound policy and our center, and trying to show how we support some minority in Taiwan, because as you know, the Taiwan CDC or the whole government have been working on the pandemic for, they did lots of great work, great job, but still there are some people, they need our help. So from this point of view, we would like to help those people who are in need of our help. So we will focus on the New Southbound policy and the New Southbound, our center, and mainly focus on what we did during the pandemic. And we are still working on it and trying to support those who come from Southbound country or going to work or be a volunteer in the Southbound country. And so briefly, in the August of 2016, then the government trying to promote some, no new relationship to other country other than China only. So we would like to gain more relationship with the South Asian nation or the Southeast Asian nation, and also New Zealand and Australia. And the aim of the policy is to achieve some multi-faceted cooperation and try to gain mutual prosperity. And the four main aspects of the policy is to gain more economic collaboration and people-to-people exchanges, resources sharing, and the regional links. And based on this policy, we develop our center. So it's a collaboration with the Taiwan Disease Control Center and also the National Taiwan University Hospital. And as you can see, there are more and more people go inbound or outbound to the New Southbound countries. Yeah, so last year we have many visitors to the New Southbound country, including like Vietnam, Thailand, Singapore, Philippines. And then we have many people came from this country last year. Like you can see many people, they were from Malaysia, Singapore, Philippines, Indonesia, and about 700,000 people, they work here. They are not visiting Taiwan for just travel. So they work here, they stay here, And the aim they stay here is to help Taiwan in two aspects. One is to do the healthcare. So they are health taker, health giver to support those who are very weak or functional decline. And another aspect, they work on the infrastructure. They did lots of labor work and try to participate in the engineering or any kind of infrastructure development. So these people, they are quite important in our country, but there's a lack of healthcare or attention to their health or their right. And as you can see, this year, from January to May, although there are very few visitors from other countries, but there are still many visitors from the new Southbound country. It means that previously there are lots of visitors, they are travelers, but that during this month, although there are the pandemic, lots of restrictions, still there are many people, they come from the new Southbound country, helping us to care those who are with severe disease or dealing with all the infrastructure engineering. So about 2 years ago, we have a new service collaborating with the Taiwan Center for Disease Control. And so we try to help those who go outbound to new Southbound countries or come inbound to Taiwan. The initial aim of our services, the first aim is to do the infectious disease control, such as any kind of like blood, sexual transmission disease, or any insect bite disease, or airborne disease, any infection disease. Also, to provide some chronic disease management from our center. Yeah, but actually, this year during the pandemic, so there are no more travelers, and so there are less outbound visitors to this new Southbound country. So we focus more on how to help those who come to Taiwan. And our service, we have a platform, and so we can provide multi-language support. So in our service, we have some people do translation in English, Indonesia, Thai, Vietnamese, and Filipino, and English. And anyone need our help, they can call or use our website or platform, and we will have healthcare management to help them to find the accurate entrance or the service they need. So the next, I'll introduce what we did during these few months. During the pandemic, the first thing is to get more health literacy to all those who are in need of this information. And we try to deliver this information in different languages, including Chinese, English, Thai, Vietnamese, and Indonesian. And this is the Chinese version. Actually, the topic of this information, they are based on some very popular TV show or comedies. So it's quite popular, and many people, they use it and send it. And we also concerned because the CDC, they have already lots of information. So we have to try not to alter their information, and also try to help those who are in need of our information. So let me introduce all of these pictures to you. So in February and early March, we tried to, the first one, the virus crash landing on you. That means there's a pandemic, and it's a global issue, and we have to be very careful about this disease. So the first one is like an introduction of this disease, and there are many links to after this this information. And the second one, we deliver it in March and very early April, and let people know how to wash their hand carefully and correctly. And the second one, as you can see, there's the mask. But you know, because initially in Taiwan, there are some crises related to masks. The first one is that there's a shortage of masks, and for those who come from the new Southbound country, they don't know where to get the mask, and sometimes they didn't use it correctly. So we use this picture to draw their attention, and also follow this picture. We try to provide the best way to use their mask correctly. And the fourth one, as you can see, in our hospital, because during the pandemic, then there's a limitation of visitors or caregiver. So only one caregiver can be, at the bedside helping the patient, and most of them are from this country, such as Indonesia, Vietnam, or Philippines. And because there's a shortage of masks, we found that many of these healthcare takers, they use alcohol and just spread it on the mask. But we all know that it will, disrupt and the structure of the mask and make it useless. So after we found this, this behavior, then we try to let them know how to use the mask correctly and where to get their mask. So we have Thai version, Vietnamese version, Indonesia version. And also, as you know, there's a traditional festival for Muslims, and it's really important to all of these people, but they are not allowed to gather together and celebrate this festival. So we invited some senior people who are with Muslim religion, and try to let these senior people communicate with those who stay in Taiwan and work in Taiwan, and try to figure out some alternative way for them to celebrate the festival. Also, for some outbound patients, because they don't have the access to take their long-term medication, so we also provide some very easy toolkits for them to take their medicine and control their chronic disease. And also we have some update for all those who work in this Southbound country. And we also deliver our information to many media, such as Facebook, Instagram. And though there are more than 300,000 people, they can gather the information from us. And also there are some people, they work in this country, they are quite panicked, and we have some collaboration and online support to these outbound people. So here's my conclusion. COVID-19 pandemic is really interfere lots of people's work and life, and we try to provide more care to support the people in need. And I think diversity and inclusion is still very important in this war fighting COVID-19 pandemic. And I think the only way to have a better outcome is that we try to provide better information and promote all people's health literacy. Thank you.
Presentation, very live presentation, and very practical. I guess maybe to the end of that, you can take a few questions regarding for the student international travel to return, to open up the border, which is quite critical for many countries. Now we have the third and the last speaker, Dr. James Tang. He is now in Ida Hospital, and he got his medical degree from University of South Alabama, and now he serves as a specialist of the gastroenterology, but also health literacy instructor in the south of Taiwan. So, Dr. Tan, you have the minutes.
Thank you, for Professor Peter Chang, and thank you, President Sorensen, and also our honorable colleagues across the globe. Let me share this presentation. Hold on a second. All right, here we go. All right, so the topic I'm going to be talking about today deals with our hospital, IHLA hospitals, COVID-19 strategy, and also I'm going to discuss about some health literacy practices that we use in our hospital. And I'm sure there's a lot of medical centers in Taiwan have similar practices as well. Now IHLA Healthcare Group has 3 hospitals. The main one is the IHLA Hospital. We have about 1,250 beds, and then we also right next door have the IHLA Cancer Hospital. This is a secondary care hospital that specializes in cancer treatments. And we also have a newer hospital, IHLA Chang Hospital, it is also a secondary care hospital that deals with pediatric and gynecological patients. Now, the main IHLA hospital is a tertiary academic medical center, and we are accredited by the Joint Commission International, which is based on the United States standards for medical center accreditation. Now, going through in the IHLA's 5 parts of services, the first one that we have the founder's heart, our founder Lin, his philosophy to focus on giving back to the community. Continued by the physician dedication. We have physicians in Taiwan focus on patient-centered care. The third one is the nurses' thoughtfulness. The nurses play an integral role in our patient-provider relationship. And the fourth one is the hospital warm atmosphere. With a shifting away from the hospital atmosphere to the care environment. If any of you have visited our hospital, many foreigners say we look more like a 5-star hotel than we do more than like a hospital. And also we use up-to-date technology, innovative up-to-date technology as well, promoting advanced medical research and international collaborations. Now, IHLA has 2 medical schools. One is for Taiwanese students and one is for international students. So one's completely in English and one's in Mandarin Chinese and also English as well. For our IHLA hospital, our epidemic prevention strategy, we review our strategy every single year with tabletop exercises and or drill simulations. Now, this includes infection control measures that are audited every year. It's related to the Centers for Disease Control Act, and the contents include the disease surveillance control, epidemic prevention education training, response measures to different epidemic levels, PPE distribution and inventory control, manpower deployment, isolation ward areas, bed-to-bed transfers, public access control and patient triage guidelines, suspected cases, specimen transport process, safety protection measures, environmental cleaning and control, corpse disposal, and patient transfer process. So as you can see, this is quite detailed and quite conclusive. Now, the most important thing our hospital did was we followed the Ministry of Health and Welfare of the Taiwanese government and recognized the crisis early on. So December 31st was when China reports unknown outbreak to WHO. Taiwan CDC started the health checks for flights from Wuhan. On January 1st, we have the basic fever and TOCC station set up, including the ER triage system at our hospital. And then January 2nd, we notify staff about pneumonia outbreak to be on high alert, not just medical staff, but also the nursing staff as well. And on January 15th, we added COVID-19 update section on website for staff. And then follow up by release our contingency plan for January 20th. And follow that, establish incident command teams, which included daily meetings and briefings about the newest updates of COVID-19. And then follow that with develop face-to-face online COVID-19 lectures. On January 26th, we enforced mandatory masks for public and personnel, public access and control. This is the beginning of the public access controls. Now, from February 5th, we have the PPE inventory, and the system is revamped, focused on prioritizing supply. And then employees are asked to avoid epidemic areas. And we also restricted employees from traveling outside the country as well. And then on February 7th, we used the National Health Insurance Card system to begin the TOCC review process. And we also established outdoor outpatient clinic for high-risk patients that were returning from China or other endemic areas. And then we have increased frequency of cleaning and disinfecting. We also established hospital personnel quarantine process and communication guidelines, followed by established outdoors pharmacy drive-through so the patients don't even have to come inside the hospital to pick up their medications. And we also banned meal deliveries entering the hospital. And then we also, as the time progressed, we banned gatherings of over 50 people. And also we established telemedicine guidelines. And we also reduced as much elective surgery as possible. And then in early March, we have social distancing guidelines for our food court areas in our basement. And also we have resting areas for high-risk care teams set up. So as you can see, as the time moves on, we have various different drills and various different protocols established. And then on May 12th, the public access control restrictions were eased due to the pandemic in Taiwan is under control. Now, for steps for entry to the hospital at IDA, you must wear a mask. And once you get in, you must use hand sanitizers. If you don't, our staff will apply it for you. Step 3 is we check your TOCC and history, and you get the stamp to get clearance to move around the hospital. And step 4 is we check your body temperature. And then only then can you really enter the hospital and to see your medical appointments or visit patients. Now this is the gradual implementation of the epidemic measures in our IDA hospital. These are the pictures for you to see. We restricted food court access to takeaway or 1 person per table. It used to be we could sit 4 to 8 people per table. In the waiting areas, we removed the middle seat or replaced the tagline saying this is for social distancing and people were not allowed to sit in the middle area. And then we use plexiglass shields to prevent spread of airborne germs in our various counters. And we also have social distancing labels for our pharmacies. And we have meetings with over 30 people shifted to video conferencing. We established the outdoor area for inspection of suspected cases. And this is a picture for the outdoor drive-through pharmacy. And we also increased frequency and replenishment for the hand sanitizers throughout the whole hospital. Now, regarding the area of health literacy and COVID-19, we have various collaboration with amongst our departments. We have coordinated schedules, communication, mental health support through all departments for all staff, early communication with patients about new policies. And the hospital policies, hospital may not disclose if they have any confirmed cases without our information. And daily updates, we have incident command team meetings, daily reminders, websites updates, line groups, and visuals for the public. For example, we have this hand washing video made by the superintendent for the Chang Hospital, Superintendent Chang. And we also have staff resilience and motivation, safe space, dormitory, mental health support, open communication, transparency, creative health literacy avenues like TikTok videos, art wall, and these are some of the pictures. And we also community health literacy program recently restarted. It has and also regarding the health promoting hospitals at IDA, we have the of health education resources to the community level, like such as board games, because it increases participatory interaction with the community. And we have easy to read communication materials. And we also have health literacy interventions for the vulnerable populations, such as home visits with older adults with medication safety instructions and fall prevention education. These are the pictures. Now, we also have organized health education courses for the community. This is Director Julian Lin of the Community Medicine and Family Medicine Department. And we also provide free one-on-one health consultations and targeted health education materials for rural areas in Taiwan. And this picture is the Chairman Du. He is the chairman of the entire IDA healthcare group, encompassing 3 hospitals and nursing homes. And again, important announcement at the end of my presentation. We have a Global Health Literacy Summit. Our President Kristine Sorensen has talked about this. An important day is the abstract deadline submission is February 28th, 2021. And that concludes my presentation, and I'll defer it back to Professor Pierre Chang.
I see many of the practice in the hospital could be very useful. Now we have luckily having 15 minutes. So I see Kristine is still with us. So I am wondering any particular question we'd like to share with the three presenters, that Dr. Lin and Dr. Peng and Dr. James Tang. All right. Any questions that please let me know, or I can ask some question which is already attempt right after your session.
Perhaps while our participants are considering their questions, I have one question. What did Taiwan learn from the SARS that could help you in this new situation? Because, for example, in Europe, where I live now, we didn't have a huge outbreak of SARS. So we see now we were very much unprepared. So what did Taiwan do to prepare since SARS?
Are you targeting this to Dr. Lin?
Yes.
The first speaker? Professor Lin Hsien-Ho, would you like to respond?
Yeah, I can talk a few. I think many different aspects or many different sides of the society has learned from SARS. I think the healthcare system learned during the SARS outbreak. Maybe James Tang can talk more about that. The society as a whole also learned a lot. So I think in general, during the SARS outbreak, what the society learned is that we can be very vulnerable to this new outbreak of unknown infectious diseases. So the experience we learned from SARS is that you have to be very quick in terms of acting on the new outbreak, and to adapt new like putting on your face mask, different lifestyles. So people are very willing to do these various changes of lifestyles. So, I mean, this is done in the absence of a strict lockdown from the government. This is mostly spontaneous. So I think that's probably is very different from what we are seeing in the US or in the European countries, that many people are still thinking or questioning about this kind of the use of social distancing or face mask or things like that. Whereas in Taiwan, the government has to even secure the face mask, so that because people knew that it's going to be very useful, and people proactively tried very best to secure this face mask. So I think that's the sort of the lifestyle and the behaviors from the society, something we learned during the SARS outbreak.
Dr. Lin, can I follow up with a question that many people are wondering when we can finish this pandemic, or how are we going to tackle the second wave, which is surrounding and continuing? So do you have any recommendation of what Taiwan is doing to countermeasure that second wave?
Well, it's a big question. So I think your first question is when this will be over. Is that globally or in Taiwan, or?
Well, globally and both also in Taiwan.
Yeah, I think it's interrelated. I think it's not going to finish anytime soon. It's a new pathogen where all of us are susceptible, and so far there's no effective vaccine, or there's no magic bullet in terms of treatment. We know remdesivir might work, dexamethasone might work, but they only reduce the mortality to some extent. But the transmission of the disease is still largely depending on the sort of herd immunity and the background transmissibility of the pathogen. And I think what we've seen so far in the past 6 months is that this disease, this COVID-19, is highly transmissible, and it's capable of transmitting even before atypical symptoms develop. So all these, traits or the natural history of the disease suggests that the control of the disease is going to be very difficult in the absence of vaccines. So we've actually done some modeling analysis, try to look at the impact or the potential impact of what I call case-based interventions, contact tracing, quarantine, and population-based interventions like social distancing and face mask use. And I think that the brief conclusion is that we probably will need both. We'll need both contact tracing, quarantine, and social distancing to really bring down the epidemic to a low enough level so that the reproduction number is lower than 1. So I think before effective vaccine is available, we'll probably have to be very alert and very vigilant for the next wave, second wave or third wave, because whenever there's currently most of the population, even now, is still susceptible. It's the same. It's true in Taiwan. It's also true in the U.S. and the European countries and in many other countries. So I think there is little room for relaxing right now, and we'll have to be very vigilant at this stage.
Thank you, Professor Lin. I'm Peter Chang. I recorded from the audience. It's a very interesting question. Maybe this question we can ask Professor Peng to respond. McLemon asked, is there a health hotline for people in Taiwan to call if they have symptoms? And if yes, is this hotline multilingual based on the Southbound policy? That in short, that do you have a Vietnamese or Indonesian hotline people can call to learn of the update of the disease? Dr. Peng, please.
From the Taiwan CDC, and I think that's really a hotline because there are lots of calls, no matter from people or the hospital or healthcare worker. So there is a central line, and the CDC, they have a call center, and lots of people work there. If they have any language problem, they will refer the case to our center. So we did receive some hotline. But most of these, the call, they are quite minor, like they worry or they want to know how to test the COVID-19, the RT-PCR, or what's the quarantine limitation, how to get the the insurance health care. And so the first question is, yes, there's a call center in Taiwan organized by CDC. And if they have any language barrier, they can send these people and their information to us. Thank you.
Thank you, Professor Peng. May I, because time limit, may I ask one question to James? You mentioned about, because you've been the hospital setting is well prepared, but I recall there are many fishermen. They are going far away for 2-3 months to some other Pacific area, and they returned recently. And there are a big effort to quarantine or provide surveillance. And also you have many international students coming to your campus. So I'm wondering, Dr. Tang, James Tang, that can you tell us more about how to deal with this international traveler, the migrant or migrant student or international student? Are you having some particular measure dealing with the challenge?
That's an excellent question, Professor Chang. I'll defer to Chief Louis Huang, who's the the Chief of the International Medical Education to answer this question. Louis?
Okay, so basically for our international medical students, our school, our Hsien University, and they launched a new regulation, which is to do a 1 month guarantee if our international students want to go back to their campus and then continue their study. And meanwhile, they also start lots of courses, and they did a lot of changes in the campus, and also implement in our clinical rotation and their final OSCE. So for example, during their daily clinical rotation, we need to protect our international medical students. So they need to measure their temperature every day. And we also provide masks and certain personal protection equipment to those students. And finally, when they need to pass the final OSCE high-stakes exam, we also provide additional protection and instructions for these students and our standardized patients in order for them to get high-quality medical education during this COVID-19 outbreak.
Thank you so much, Dr. Wang. Now we have a last 4 minutes, and we have 2 questions. And I would like to put these 2 questions together to Dr. Lin. First question is from Sri Handiani, apparently from Indonesia. She asked, what did the government of Taiwan do to manage the misinformation and the overloading information of COVID-19 in the community? So last question from Sri Handiani. The second question from Dr. Fukuta from Japan. He has very interesting question regarding Taiwan has using the speedy IT and risk communication. But his question is, why was that possible? Could be achieved in Taiwan. You know, apparently Japan also holding such an excellency and technology, but there are some problem in terms of the countermeasures. So Dr. Lin, would you like to respond to these 2 questions in 3 minutes?
Sure. The first question is about the misinformation. Yeah. I mean, I don't work in the government, but I'll just say what I observed. I think one important measure is that they have this daily 1 minute brief about the information and about the key measures, so which appear in all media channels. So it's kind of one minute a short video thing that delivers the key and correct information about COVID-19. So I think that's very useful. And second is the this Line, the mobile phone apps. They have a very popular Line channel, 疾管家, which is developed by Taiwan CDC. So every day, not every day, but maybe every hour, this Line app would deliver important message to people. And I think the registration rate has been once very high, like 10% or something of the total population. That's a very useful channel to deliver correct information as well. I think these are the main things that I can remember. And the second question is about why was that possible that Taiwan's government, again, I don't work for the government, but I think probably we learned again from the SARS experience a lot. During the SARS epidemic, at the beginning, everything was very chaotic. So there was no central command center, and the information delivery was very messy. So and it was gradually throughout this, I think this 4 or 5 month SARS period that people from the government quickly uptake some changes so that the risk communication has been largely improved, and that was I think that was that kind of lesson was very important for this time, and for the IT application, I think The executive Yuan has a very strong IT team that work very closely with Taiwan CDC. So I think we're lucky to have this kind of cross-sectoral collaboration. So that's probably one key as well. Thank you.
Well, thank you, Dr. Lin, for this precise response. Due to the time, I would thank all the speakers, Dr. Lin, Dr. Peng, and Dr. Tang, and including the Tara of the IHLA IDA team in South. And I thank all the participants, and particularly those raised questions. I hope you enjoyed the presentation today, and I believe the IHLA would make this webinar available to the others. And so I thank you for joining us. Maybe Kristine, one last minute?
Yes, I would like also to thank you on behalf of the International Health Literacy Association, to thank our speakers and our hosts in Taiwan for this very, very informative and fruitful webinar, where you shared your lessons learned not only from the current pandemic, but also from the last one. And we are very happy that you're sharing your experience, your tough experiences with the rest of the world. And I want to thank every one of you, as well as our participants who are working really hard now to fight the pandemic. And I saw that on one of the PowerPoints, one of you had said, you know, stay strong. And I think this is the message we need to keep on highlighting, that we should stay strong, because this is not going to end around the corner. It will take months and perhaps years. But we do hope that we can meet you in Kaohsiung next year in October, when we have the International Health Literacy Association Global Summit. So it's for me now to say thank you to everyone. We hope you will meet us again in the next webinar, which is 24th of September, also on the response to COVID-19. So stay healthy, stay strong, and stay safe. Thank you, everyone. Have a nice day further.
Thank you so much.
Thank you.
Thank you. Bye-bye.
Bye.